What causes thyroid cancer? Although the exact causes of thyroid cancer are not yet well understood, there are two main risk factors that make getting the thyroid disease more likely. Exposure to radiation, a family history of thyroid cancer. How does exposure to radiation increase the risk of thyroid cancer? The effects of radiation exposure depend on the amount of radiation and the age at which the person is exposed. The higher the dose of radiation and the younger the age of exposure, the greater is the risk of getting thyroid cancer. Exposure during childhood raises the greatest risk. Most exposure to radiation comes from medical treatments like radiation therapy to treat breast cancer or lymphoma, or from the environment, etc. The amount of radiation in routine medical tests like mammograms, X-rays, and CT scans is low and not thought to significantly raise the risk of getting thyroid cancer. Still, lead aprons may be used to cover the neck as a precaution, and radiation tests should be only used on children when absolutely necessary. How does a family history of thyroid cancer increase the risk of thyroid cancer? Some cases of thyroid cancers are associated with positive family history, meaning that someone in the patient's family, usually a parent, sibling, child, or grandparent, also had the disease.